we give a very quick introduction. Then we will try to tell you what is cheetah. Just give us another few moments. And then we will more or less use this particular 30, 40 minutes to tell you the lesson we learned, and which probably can save everyone time to see how urgent we have to deal with healthcare reform. So whatever we learn, we don't want to be repeated in Grand Rapids area. Then particularly, we like to see the future. So after we have shared the lesson learned, then Dr. Falan will give far more details about the partnership we can build between these two cities, number 2 and number 3. Number 2 is Grand Rapids, number 3 is Kalamazoo. So introduction, and the center is pretty young. We basically had the pressure from the community, and that gave us the incentive to see if we are able to work together across different colleges. And this is the thing born out of the advisory council, and then from hospitals. And Dr. Brown says, you guys really have to get into healthcare. When I was in the department chair, that was back more than 7 years ago. But then we understand that healthcare is not just deal with people. Healthcare deal with many, many facets, including the workflow, the necessary patient care, diagnosis, but more deal with sharing of information. So this gives us the incentive that we want to build a center that will allow information technology professionals can work with healthcare professionals. So this is how we started. And in order to justify the resource use, we cannot duplicate the same thing in healthcare for the things already done, the other can. Same thing, equally speaking, we cannot create another few professor position by teaching health informatics in business school. So that's the thing we had this idea. But more importantly, it's not just between two colleges. We want this to be a center produce resources that can be shared by all students and all faculty. So how we can do this work, honestly speaking, it's not easy because we have to really start it with the easy part. So how we can be recognized by people as a valuable piece that we started with is projects that deal with things people really care by the community. Then we found out we do need more new workforce. So that's the reason center quickly recognized we have to develop a new major. And this new major, by the way, I didn't really purposely make everyone copy. It's the major we created just to bundle things together between colleges. So that will give students a training. Easily they can join the industry from different angles. So this is the new major called Health Informatics and Information Management. And then we know that the United States is famous about education, so we have to do more towards the research. So then we hold our conference to get together national and international scholars. So when you see here, what we do actually is a trifocal endeavor. And that really means we have to really get into the community by understanding the services, which are the things we care the most at this moment. That is the first task we do in 2010. Then we found out we need people who are able to replace the baby boomers. So then we get into this new major. And I pronounce this just like you go to church, it's a hymn. It's a harmony. It's a health informatics, information management. So this means it's a fully consolidated program. It's not just one way or the other. It's blended. And that is the program Dr. Falan and I, we spent more than a year to develop. And then quickly we found out this becomes everyone's interest. So we have the luck to come to Grand Rapids even more than 3 years ago. Then we found out all this nice playground in Grand Rapids. And you see Spectrum, we also see Spectrum. So then we found out this is the thing, give us the resources so we can hold this international conference. And that really promote faculty members to do research. But more importantly, you are still, I assume most of you are very young. What we want is we want the donor, the funding agents, give us more additional resources. We can be more innovative. This is the way we try to do. In fact, this is just like a snowball. It gets bigger and bigger. And so when you see here that we have to reflect how we define the center. And of course, we are just a higher education. So we want to be the leading institute. We want to really focus on health, information technology, research, education, and services for the sake of we can deliver best health care with the following things: quality, safety, security, and sustainability. But today, this is not a focus. Just to tell you, we have this vision in our mind. But our mission, actually, today we had lunchtime together with Dr. Clement and a few other faculty members. We want to integrate talented faculty and students to work with our community, Grand Rapids, Kalamazoo, in the state of Michigan, the national and also international, in order that we can conduct synergistic, interdisciplinary, and innovative research, education services. The purpose is we want to be more efficient and effective, to be the leader of the whole globe. United States has been the leader in many areas, but we are far behind in healthcare. If you know more about healthcare, we are far behind. So how can we be the number one is our goal. And I'm pretty sure Dr. Clement has same thing in her mind. So what we like to do is to create a center. This center is nothing but promoting interdisciplinary and collaborative research. How can we do that? And if you come to university, you must have a reason to come to GVSU. There are many kids go to Western Michigan. I hope that today is the time for you to rethink. Higher education has been compartmentalized. I call it functional silos. So if we want to do things, we want everyone to see each other eye to eye. So the Center for Health Information Technology Advancement is to create this kind of link across all different colleges. By the way, we do have 7 colleges, from College of Aviation, Hayward College Business, College Fine Arts, College of Education Human Development, College Health Human Services, College of Arts and Sciences, College of Engineering and Applied Sciences. Plus, we will have new baby born in this fall. That is our medical school. How can we really integrate together? That means we all do research with the common mind. We can solve the healthcare problem. That is the only way we can see center can make effective use. As I think about this, the first 5 minutes when I talked to Dr. Clement, she has that in mind. We have to really do a faithful job to use the resources we have in order to really make United States come back to the leader in healthcare. So at this moment, we are not quite outreach all the colleges. So far, you can see we have faculty members from business school, from education, and then from health and human services do research grant together. And just about half hour ago, we like these things to happen between GVSU and WMU. So this is the goal. So hopefully that when you sit through this presentation, Dr. Falan's presentation will trigger some thinking that we can do together. So if we see we have such a huge rosy picture, you know, it's a dream. So it's hard for you to say you are happy if you don't have a dream. But we do have a dream. But our dream is not fulfilled, but we do have our lessons. So this 2 slides from my personal part is taken from the HIT viewpoint. HIT stands for Health Information Technology. But however, I don't want to claim this is only business school. In the United States, HIT represents everything. If you go to the CMS website, they use HIT. That inclusively cover health informatics. Okay? So from my side, because I'm from business school with information technology, so it does show a little bony stuff. You know, it's very bored, but then I tell you what the lesson we learned. Mine is service providers are very busy these days because everyone is involved with some kind of go-live projects. And Spectrum is doing very well. And so many other hospitals, they don't have time. And I can tell most hospitals don't have time to give you critical projects. So we had this started in our first year, but then we found out critical projects not available. So this means we understand they have to resolve their internal issues. The second is we found out this is the playground. All different kind of industry coming in. They all put on the same hat, HIT. So today, you have to be happy. Many vendors want to join the sandbox, but we only have limited space. So what this means is it's an innovative area. If you are in this field, don't change your mind, stick through. So at this moment, only thing bothered the service provider is there's no proven ROI. If in case in business school, you know ROI stands for return on investment. Because of this, so people still kind of hesitate in adopting all these new tools. The third is the vendors of this EMR, EHR, very competitive. I can tell you the top 5, they are doing the cutting throat competitions. So because of this, they are not willing to share their resources. It's very understandable. So that means we will have a little extra burden. Your professor will have extra burden to steal things from somewhere to teach you in the class. I use the strong word steal, not because the ethic issue, because we are not allowed to grant the license to use, then we have to find resources for you. So this is the third part, it's very difficult. And the other thing is the purpose we create a center. We really believe that when you see this presentation is we want to promote more and more interdisciplinary research. In other words, this is United States. I always tell my students, no incentive, no motion. So are burdened by your own mission, or you are given incentive. So this will be the things we want somehow the state, the national give us this. The other thing is we also should be willing to share our experiences. So that's part of the reason we have our lunchtime. We'd like to share experiences. So hopefully GVSU and WMU will become two sisters university, really hold hand in hand. So that's the purpose we want to be here again. So now, the second part, I want to tell you the good things. Once you have negative things, you also have the positive things. So this is for you. I am approaching the retirement, but I do want you to take this into your heart. First, there is a huge potential for curriculum growth. In other words, if you want to be a master or PhD, then you will have no doubt to have multiple job offers. So this is the time I can promote more education in doing HIT, HIM education. If you are the recipient of the education, you will find a job. But if you want to pursue advanced degree, then this is the field you will really become the great contributor to the United States. The second is there are too many job openings. It's good and bad. Good means this is just like early 1990. Everyone learns some Visual Basic, you can find a job. But today, everyone knows a little more about healthcare. With technology, you will find an internship. So I want to tell you the hurdle is very low. And in fact, that's the positive side. Our students get a lot of internship just for the past 2 summers. The third is we do see we are given many potential value-added tools, but these tools still at a young age. So because of that, so we are able to negotiate with the HIT vendors that will give us a chance to own that free use of the software so we can bring into the classroom. Just a moment ago I say steal. Actually, we don't really steal. We just go to the HIT vendors, ask them to give us the tool to use. They are willing to let go. The last one is we do want all the researchers, professors. Personally, I want to tell Dr. Clement, this is the part I have to be very honest. You touched that, I won't say. There are many projects in the community which are available for us to grab. mental health is one. So there are many practical projects. If we can work together, then we should come back to communicate, to exchange our thoughts. And Dr. Falan is doing some project. So all this project will truly create a momentum for us to do more research. Ideally, we hope that we can write joint research grant proposal. So this is the thing is popping up. So that's the thing I want to share. Now I want to pass time to Dr. Falan.
All right, thank you very much for inviting us to come today. I do appreciate it. Before I go any further though, I want to know what disciplines are represented here. We have nursing, right? Mm-hmm. What other ones? Speak up, anybody.
Physician assistant studies.
Okay, good.
I'm a physician and a nurse.
All right, good, wonderful. Any others? And raise your hands if you are students. Okay, good. And then faculty? All right, well, we have a good representation from all perspectives. Well, that's wonderful. Good, because that's, I'm going to be talking from both of these perspectives and more with this part that's coming forward now. So, I just want to give you a little bit of background about me. I have been in the healthcare system for many years. I'm a nurse by trade, been in that realm for 25 years, and became very interested in informatics when I took a course from Kathy Young at Western Michigan University a long time ago. And when I took that class, I knew that that was my space, and that's what I wanted to do. I went to the University of Michigan and got my master's degree in nursing administration, focused on informatics there, and then went on with my doctoral degree at University of Michigan and further pursued this informatics space, combining it with the cognitive learning. Why is this important? Because what I've learned there is directly applied to what I do today. When we're talking about technology in healthcare, we're not just talking about just technology. How many of you have had difficulty using a technology? Anybody? Raise your hand, hi. Okay. If you've had difficulty using a technology, that means that there's something missing. There's a human factors piece, right? How many know the definition of human factors? Okay, what is it? Human factors.
It's all different pieces of our human nature that interfere with the adoption of health information technology.
Yeah, and it goes into how products are designed so we can use them more intuitively, right? So you don't have to try and guess and figure it out. You see things and it guides you through the whole process. Well, in healthcare, this is a critical piece, is being able to use information technologies, being able to get information from it, and so forth. Well, what happens in healthcare, whether you're a nurse, whether you're a PA, whether you're speech or social work, is you are working in an information-rich environment, right? And when we're talking about informatics and information technology and their use and their adoption, and what is it that I need in this information-rich environment, we have to know what is essential, right? Each environment is going to have different aspects of that information that's essential. Some people are going to care about X, and other people are going to want to marry A. That's how important it is to them, right? Okay, so we really have to take the time to explore what's really essential, because we don't want to waste our efforts. How many of in here, especially faculty, have had to waste efforts? Okay, do I have some? Okay, a lot, right? So we don't want to do that. The next thing is, boy, in healthcare and using HIT and health informatics, stakeholders, let's name one. Who's the stakeholder in healthcare?
Insurance.
Insurance, good. Who's another stakeholder?
CMS.
CMS, oh yeah, good pair. What's another?
Patients.
Patients, right. And then who else?
Providers.
Providers, okay. And who else? And who else?
Healthcare organizations.
Yes, and then you have families too, right? So do you see, we have a complex web of stakeholders. All of these people are interested in this. in understanding the technologies and understanding the information and how to get to it and what to do with it. And so as faculty, when we're working with students or we're partnering with other organizations, we have to be mindful. This is one of our strategies. We have to be mindful of the stakeholders. If we aren't mindful of them and seek to understand the different perspectives and the different views and the different values of those stakeholders, we're going to be in trouble because we won't be able to help them to the degree that we could. And that means that we leave some of our own biases behind. We have to know our biases. Just because I think A is ultimately important and you think B is, I have to let go of A, right? If you really need B, how important is A to you? Not so much, right? So we have to be mindful of that. We have to know, okay? So we have multicultural environments too. Boy, this is a big one. Healthcare organizations, do they have a culture? Can it be varied from one organization to another? Yes? Okay. How about in academics? Do you have a culture here where you work? Do you have a culture here as being a student here? Right? Are they all the same? Is the culture here the same as at your home? No. So when we are working with, as Cheetah is working with our partners, we have to be very mindful of culture. We have to know it. We can't just plow in there and assume that we can just take over, because you will find as you're moving into the space as well and you're doing these things, it's very easy to insult people. How many people have been insulted by somebody coming in thinking they know your culture and they don't? Has it happened?
Mm-hmm.
Sure. And then do you really want to share too much with them? No. So it's something that we need to be trained in, to be conscious of, to really critically think about. How is this culture a little bit different than what I'm used to? What do they value? Culture is about valuing, right? It's all about valuing. So we have to come in there with that in mind. System functionality. All right, Ms. Cheetah, when we are working with different organizations, or we're working with students, or we're working with faculty, it is not enough to just be present and not have knowledge of systems. Now, I'm not saying that you have to be fully aware of all systems, because that isn't very realistic. I mean, if you're in an environment and you're using Epic, what you learn in Epic, those kind of transitions, the functions are easily applied to other systems. But we have to know something. If I bring in students, or can I call you Bernie? Is that right? Dr. Hahn? I like Sharie. You can call me Sharie for today. If we go into a healthcare organization and we are taking students with us, which we do, and we want to help an organization solve a problem, we have to know something about their system. Now, workflow, you can do workflows all day long. But if you don't know the system that they're going to apply that workflow to, you might run into some difficulties. So you do need to have some background in how systems work. You need to have the hands-on with exploring them, finding out, well, what's good about this system? What's good about this one? Now you've got two good systems, which is better and why? Can you answer that? So when you are learning and you're growing in your space, you have to be able to evaluate these things. And then even as faculty, working with organizations or your partners, knowing something about the technologies is important, and having the hands-on ourselves. And we do that. If you're not liking technology too much and you don't want to experiment too much, then that's where you're going to have to push yourself a little bit. Pushing yourself, is this good or bad? Yes, for most of us, we like it, but there's some people that really don't like change. And so, at some point, they have to make some decisions about that. All right, and this gets me to this next phase of adoption and usage. So as a center, we are really helping people to try and solve problems in their organizations. We're trying to teach, we are teaching students how to use technologies, how to understand organizations, how to understand people, how to understand the space. And so this all comes to adoption and usage. And so with the technology piece, you do have to get informed about the technology, and you can't turn away from it. And it does challenge us sometimes, and we aren't expected to know every single piece of technology. I would venture to say, Dr. Koviak, do you know every single piece of technology?
Absolutely not.
Okay, so, but you have the knowledge and skill to do it. You're an expert in that. And so because of your experiences, well, we are building students, just as yourselves, building students to become experts in that. You won't know every single piece of technology, and it's not expected that you do. But you will be coming to that. Hands-on experience is essential. The organizations, I said before, you know, this culture is a huge thing. Organizations, boy, have a lot of different priorities. So they have a culture and then they have priorities. We might be working on a project with an organization, and all of a sudden from the top, or you know, from somebody that's even beyond that controls this organization, says, hey, we were going to do that, but we are stopping midstream and we are going to do something else. So in our learning and in our teaching and how we work with students is we have to help find ways. How do we exit out of something that we can no longer be in? Okay, because of priority changes within the organization, they say, no, we're going to do something different, we're really sorry. The culture, feedback, and productive interactions is really, really necessary. I have to tell you, the culture is so huge that attention must be paid to this. And to be able to really evaluate and get some feedback on your understanding of different cultures is a very optimal exercise for yourselves. Business cultures, I think the cultures say, I'm just going to name a business, and I don't mean to offend anybody in this statement, but say, do you think that the business of culture in Walmart is the same as healthcare? No, not so much. Would healthcare costs be a problem if the culture of Walmart existed in healthcare? Would costs be a problem? No, okay? So there's a huge gap sometimes. The takeaway for this part is listening carefully. Listening carefully. It's sometimes better to be quiet and let them talk, find out more about them. The more they talk, organizations, students, partnerships, the more they talk, the more we learn about what their true needs are. And when we're working in a space, from the informatics, HIT, partnership, all of this whole globe piece, we must listen and take in and understand them the best. Sometimes legal things can cause us some time lags. How many have had experience with this in healthcare? Anybody? Policy, oh, we can't do that. We don't have a policy for that. Okay? Have you had that experience? Right. It's, we expect that. It's going to happen. And work that into your schedules. And then, again, you're asking more questions. The other thing we have found, and I think Dr. Hahn can speak to this, is, you know, we've worked with some organizations where we were working on a grant and they weren't sure that of the skills that Western had in handling grants because they simply just didn't know. Sometimes we have to let them know, and we need to know about them too, and how can these grants be managed and so forth.